It can be hard to keep up with the list of medications you need to avoid while pregnant. There are so many, and you're often hearing conflicting information from different people. However, what about once you've given birth? We know it can be difficult obtaining the information you need for everyday life as a new parent. And unfortunately, there isn't a one-size-fits-all answer to every question. It's important to think about how drugs that are taken by moms are passed on to their babies when nursing. For example, some medications are safe while others ought not to be taken while nursing. Many medications are approved for nursing mothers, but what if you get a bad cold? Decongestants that dry up mucus can also dry up breast milk. Mucinex or guaifenesin are common decongestants, but are they safe to take while breastfeeding? But, is it safe to take Mucinex while breastfeeding? Mucinex is an over-the-counter medication that often works to treat the symptoms of a cold or flu, as well as COVID. While it hasn't been specifically studied in nursing mothers, Mucinex would be unlikely to cause harm for babies older than 2 months. However, it's important that you always consult with advice from your doctor before taking any medicines while breastfeeding, in order to learn about safe dosages and possible interactions. So, what is the max dosage for Mucinex? Mucinex, or the generic drug guaifenesin, comes in one dose, 200 mg to 400 mg every 4 hours. Mucinex should be taken with a full glass of water whenever possible because it helps loosen mucus and avoid dehydration from a drug designed to dry up bodily fluids. Is Mucinex safe for my baby? Mucinex is generally considered safe to give to babies, but it's important to be aware of the risks associated with other cold medicines. NyQuil, for example, may contain a high level of alcohol and toxic ingredients, so you might want to consider Mucinex as a better option if you're breastfeeding. Now, what are the risks of Mucinex while nursing? It's difficult to pin down a specific risk with standard Mucinex, but Mark does warn that nursing mothers should be careful of Mucinex D. The D stands for decongestant, and since the drug is meant to dry up excess mucus, it could also dry up your breast milk. It's best to stick with basic Mucinex for your cold, so you won't compromise your nursing baby. Was this helpful? Like, share, and subscribe to our channel.